Hi, my name is Lindsay McGee and I am the Waiver Manager at the Bureau of Developmental Services, BDS. These recorded training sessions are intended to provide information on each service available on the Developmental Disabilities, DD Waiver, Acquired Brain Disorder, ABD Waiver, and the In-Home Supports, IHS Waiver. In this session, we will be discussing wellness coaching. We will describe the service, talk about a scenario, and then provide any additional information that may be important to know about the service. The information in this session is applicable to the Developmental Disability Waiver, the Acquired Brain Disorder Waiver, and the In-Home Supports Waiver. How do the DD, ABD, and IHS waivers define wellness coaching? Wellness coaching services include planning, directing, coaching, and mentoring individuals with disabilities in community-based, inclusive exercise activities in accordance with the recommendations of a licensed recreational therapist or a certified personal trainer. This includes specific goals outlined in the individual service agreement, which are developed by a wellness coach, including activities that are carried over into the individual's home and community. A demonstration by a wellness coach on exercise techniques and form to include observation of individuals and explanation to them of corrective measures necessary to improve their skills. Collaboration between a wellness coach and the individual, their family, and other caregivers, and with other health and wellness professionals as needed. So how does this help me, and how does this help me achieve my goals? Wellness coaching supports the planning, leading, and coaching of individuals with disabilities in inclusive community exercise activities following the advice of a licensed recreational therapist or a certified personal trainer. Now we will walk through a fictional scenario of an individual who is accessing wellness coaching. Sarah lives independently in an apartment in a suburban area. She works part-time at a local cafe and enjoys attending community events. Sarah has a developmental disability that impacts her fine motor skills and social interactions, and she is committed to maintaining an active and healthy lifestyle. So how does Sarah access and use wellness coaching? Sarah discovered the wellness coaching service through her service coordinator and decided to explore it further. She scheduled an initial consultation with a physical therapist at her local community wellness center. During the consultation, the therapist assessed Sarah's physical abilities, interests, and wellness goals. They discussed her desire to improve fitness, engage in social activities, and learn new skills. Based on the assessment, the therapist developed a wellness goal for Sarah, which detailed how she would improve flexibility and fine motor skills. Sarah then worked with her service coordinator to improve the goal. Lastly, we will discuss any potential service limits and requirements that must be included in the individual service agreement. We will also discuss if this service may be provided remotely or while in acute care. When a service can be offered remotely, it means you don't have to be physically present at a specific location to use it. When services can be accessed in acute care, it means that individuals who are in a hospital or another urgent care type facility can still receive these important services. When waivered services have limits, it means there are specific restrictions or caps on the type, amount, or cost of services that can be provided. There is a service limit for wellness coaching. For the DD and ABD waivers, this service has a limit of $5,000 per year. For the in-home supports waiver, this service has a limit of 100 hours per calendar year. However, these are referred to as soft limits as they can be increased with prior approval from BDS. For requirements in the service agreement must identify the desired wellness goals and outcomes for the individual over the coming year. Thank you. If you have any additional questions regarding wellness coaching, please email bds@dhhs.nh.gov.